Hi, I'm Janet Gross. Welcome to Coping Today, a place where we talk about all things related to mental health and well-being. And as always, Dr. Roy Salgado, Professor of Counseling and Behavioral Sciences at the University of Holy Cross, is here to walk us and talk us through all these things and conversations. And today's topic, Dr. Roy, is student stress.
Yes, and it's a very important topic because students make a big segment of our population. Whether you are in elementary school, middle school, high school, university, or graduate school, students experience a lot of stress, and it's important to be able to address that early on in an academic year as opposed to later in the academic year.
Well, because otherwise it could build on itself, or what, that kind of thing?
Yes, and we have mental health providers within our school systems and outside of the school systems. And one of the things that we see is as a provider outside of the school system, in a private practice or at the University of Holy Cross, we might get referrals from the school counselor. So you have a mental health professional in a school system who refers out for additional services because I have identified issues. The month of October, we get a lot of referrals. So in the fall, we get an uptick. The student has been in session for half of a semester at this point, or 9 weeks. And so whether they be academic in nature or social in nature, behavioral in nature, or some sort of interpersonal dynamic, things have been noticed by someone in a school situation that they recommend that they get addressed. So October, we see an uptick. But it's important that they get addressed in that moment, because again, we get an uptick again in March. In March, we get more referrals saying the student is struggling either academically, socially, behaviorally, interpersonally, and we need to intervene. But when we get those referrals in March, the outcomes are less favorable than the outcomes in October. When you intervene early, you have more time to be able to address the issue and find a solution to it, as opposed to addressing it later. Whether it's a school or a parent who makes it or notices it later. Usually, and I don't want to throw anyone under the bus, usually it's the family, the parents, who are not acting as expediently as they could. The schools tend to notify them earlier on and maybe, we'll try to work on it and find a solution on our own. But then they wait and they say, we really need to find a solution now. But either academically, they're not going to pass, or socially, the implications are graver.
So really, now, like before the holidays, if you can get that identified, then there's a better chance.
The outcomes are greater. Yeah. When you identify the situation earlier on and start to address it earlier on, the outcomes are significantly better than waiting till after Christmas, after the holidays, into the spring semester or second semester.
And who are we talking about dealing with this? Are we talking about maybe a school counselor or a help finding someone for the child or the student, or if they're college students themselves?
Right. Great question. Whether it's a teacher who identifies it, or a school counselor who identifies it, or a parent who identifies it, or the student themselves, that anyone who sees, there's something here that perhaps needs to be addressed, to really seek resources in the fall, because the outcomes will be better. If you're noticing it and you're putting it aside and think that maybe it can correct itself, and maybe it could sometimes, but after the holidays, after Christmas, into January, February, and March, it becomes that much more difficult, because just academically speaking, grade-wise, the numbers are the numbers, and it's hard to pull up a failing grade. Yeah. Once half of the work is in. Even if you get straight A's, just mathematically, it may not work out for you. But then socially, too, if there is a social issue that has presented itself within the school system, we're creatures of habit, and if there is a bullying situation, a problem, and the student has been struggling with it, the consequences of dealing with it later on perhaps are more challenging than nipping in the bud earlier on. Mm-hmm. And so prevention or early intervention is always better than later intervention.
Okay. And we're going to be talking about that, what to do about it, identifying it and getting solutions, like you said, the resources. But before we go to break, let's talk about the resources that the University of Holy Cross has for people who are seeking help.
Exactly. The University of Holy Cross and the Maronites of Holy Cross have been offering free telemental health services for 4 years now. So anyone in the state of Louisiana, any resident in the state of Louisiana who believes that they could benefit from clinical mental health services can just call the number on the screen, and the administrative assistant will take that call, triage it to the clinical director, who will then assign a counselor in training to you, and you will get free telemental health services free of charge.
And these are counselors in training, but they've had a lot of experience.
Exactly. These are counselors in training, and they are master's level and doctoral level students who are supervised by approved supervisors and faculty member, and you're getting top-notch
Quality care, yeah.
Quality care.
Okay, all right, great. Well, we're going to take a break. When we come back, we'll be joined by an expert in school counseling to talk about success and stress. Stay with us.
Women know how to get things done. Invest in women and girls, and they will do the rest. Join us at care.org/women know how.
Welcome back. We're talking about the stress involved in going back to school, being in school. We've all likely felt it and have seen it, but also need to understand how that can impact the whole school year. If it starts at the beginning, can it build? Well, Dr. Amanda Salgado joins us now, adjunct professor and expert in school counseling at the University of Holy Cross. So glad that you're in this conversation. And we want to talk about why it is so important to address this early and maybe even get you know, the levels that this comes in and the times of year, all those kind of things. You're going to be our stress expert for school. Thanks for joining us.
Fantastic.
Okay.
So thank you so much for having me.
So we were, you know, Dr. Roy and I were just talking about the good stress, bad stress. Everybody has stress, but sometimes it can be debilitating or, you know, harmful.
Right.
So
Absolutely. And that's part of what we want to educate children and adolescents about, is to how to sort of be more self-aware with regard to whether this stress is what we might consider, you know, good stress, helpful stress that kind of helps propel us to do our best, or if it's becoming distress, if it's becoming toxic stress that can be very debilitating in different domains of life. And so addressing this early on is critical because it sets the tone for students in the beginning of the year. If we don't address this early, can really cloud the entire school year. So we want to be very proactive in being able to target these stressors and to be able to provide our students with the tools to deal with them so that they can be successful in every area of life.
You know, and if a student self-identifies, you know, whether they're a first grader or a fifth grader or a 12th grader, for them to be able to say, I feel overwhelmed, I feel that I need help, to be able to go and talk to your teacher about it, talk to your mom, talk to your dad, talk to the school counselor, reach out. We're here, the stakeholders, the professionals, the parents, we're here to help our students. We're here to help our children. So it's important for the kids to know that they can go to someone. So we as parents and we as teachers, we as counselors, we need to make that known to the students, that if you're feeling this way, if you're feeling overwhelmed, if you don't understand something, come to us. We're here so that we can help guide you.
And you know, that's the question I wanted to say, because often the stress shows up, maybe not shows up, but is expressed by a child, like I've got a stomach ache or my head hurts all the time, or, you know, those are things that as counselors, as teachers, you know, okay, they've been to the nurse 3 times this week.
Right.
You know, maybe it's not they're sick. I mean, are you trained as that? Is that how, like, things to look for in different ages? Certainly not going to be like if you're a college student, but, you know, the presenting of stress at different ages.
Certainly. You know, our little kids, our little ones don't know that mind-body connection. And so it's very important for school counselors, for example, to be able to provide that type of psychoeducation in the form of classroom guidance lessons to help little ones make those connections and to be able to put a voice or language to what they're feeling. And so kind of recognizing, okay, my tummy's hurting today and I'm feeling very nervous about school. I'm not getting along with my classmates. I don't know how to communicate with my teacher. You know, helping them sort of make those connections so that they can better advocate for themselves as they get older, and to be able to explain what they're really experiencing. And that's just not something that we're naturally equipped with as children.
You know, and being that that's something we're not naturally equipped with as children, but it is something that can be taught to a child. A child can be taught to make connections if they know what to look for, if they know to be introduced to these things. You know, that a stomach ache sometimes is due to something that you ate, or eating too much candy, or getting sick, or that you're nervous about something. And so once a child has been introduced to something, a 5-year-old, a 7-year-old, an 8-year-old, only if they're introduced to it and made aware of it, they can start to realize, I'm nervous, and put a word to what they're feeling.
And so it helps them maybe manage that in a different way than, oh, my stomach hurts and I gotta
Exactly,
go take
because you know, the
medicine.
natural inclination is to think, oh, my stomach hurts, I'm sick.
Right.
Oh, I feel sick, I don't feel well, I don't
have
want
to
to
go
go to school today, I have to go home, and not necessarily making that connection that, well, you can have a stomach ache or have your stomach feel a certain way, and it doesn't necessarily have to deal with you being sick. It could be because you're nervous. What's going on?
And so you might be able to give them tips, I guess, to help them through the day.
Absolutely. And we as the adults need to identify that. When we see this happening in a child, we need to be responsible and identify it early on and not dismiss it. Because I think oftentimes we dismiss things like this and say, don't worry about it, go to school, just get through it, and we'll address it later. And then you look up and it's March and it's a little too late.
Yeah, and to give them some responsibility in it, some self-awareness. I love
Yes.
that. That's really interesting. So if there are all these stressors, are there common stressors, Dr. Salgado, in school situations? Common things that happen? I guess I can guess a test. You know, maybe
Absolutely.
bullies, stuff like that.
Sure. So there's academic pressure there. You know, our students are, in a sense, still really trying to transition back from the pandemic era when they were not in person. And so that's a whole nother stressor that's very unique to this time for our students. And so we still have to be aware of that and how that may be playing out in certain struggles that we're seeing with our students. Adjusting to new environments, having a brand new teacher, and this teacher may have a very different teaching style or a different classroom management style from a child's previous teacher, and that can create stress in learning how to sort of transition to that and navigate that. Our students have struggles with social connections, and then something that, of course, you know, we didn't have when we were children or adolescents is social media. That plays out at school every day. And so that's something that we also need to be aware of as parents, teachers, and school counselors.
Yeah, and anymore, you can't leave that at home. I mean, I think kids pretty much have their phones and stuff with them.
Right. You know, it used to be when cell phones became a thing that students couldn't have them in school. But in my experience, what I see is that now they're there. Schools have adapted to the cell phone situation and permit them on campus. They can't be playing with them during school, but they're on campuses.
You know, kids can do this, you know, and
Right.
you don't even know that, you know.
They're very well equipped at finding ways.
So there's always someone else there in the room. That's got to be another stressor,
Right.
you know, someone else there, you know, who's having some influence. So, all right, let's go to relief or remedies for this. How do schools combat this? How do they, I don't know, relieve the stress or teach students how to deal with it?
Well, I'm going to put a huge plug in for school counselors. As a former school counselor, I see how pivotal a role they play in helping students in early intervention, prevention, just helping them have the tools to navigate a school year. And so school counselors are just an amazing support in that they are there for every student. It's not just students who may be struggling, you know, immensely. It's for every student, and so much of it is that preventative, giving them the tools early on so that when they experience a stressor, they are equipped to deal with it in a healthy, productive way. And so school counselors have curriculums that they use in which they are tailored to each stage of development for whatever grade that they're working with. And they help every child learn about what stress looks like, what it does to our body, how that mind-body connection plays out, and then different strategies and techniques depending on the age level so that they are well equipped. So I can't stress enough that as a parent, if you don't know who your child's school counselor is, find out and go talk to them, introduce yourself, and let them know what your child may need extra support with. They have such a unique opportunity as a school counselor to go in the classroom to see things that the teacher may not be seeing, that, and they have that mental health perspective that's so important. So they really kind of bridge that gap and can just be an amazing resource for a child and for the family. But you got to utilize them and know who those school counselors are so that they can give the best support possible to your child.
And to Dr. Salgado's point, I think that's a very important thing for our viewers to be aware of, that professional school counselors are mental health providers on a school site. I think a lot of people have an idea that the school counselor is what they had been accustomed to many generations ago. Many generations ago, the school counselor primarily did scheduling of classwork or courses into the next year, and they operated in a different capacity, guidance, if you will. That has changed. The past 20, 30 years, that's not the role of the counselor on a school campus. Now they are a mental health provider. They have the same training, the same master's level training that a counselor in another setting has. There isn't a difference between a professional school counselor whose setting of choice is working on a school campus as opposed to someone working in an agency or a center or a clinic or a hospital. It's the same level of training. The specific specialization is working with children and or adolescents on a school site. And so to a point, to utilize that professional who is on the campus, who can go and observe in real time things that are happening with a identified student or patient or client, so that they can work perhaps in collaboration with another provider outside of the school if need be. And I think it's important to note that mental health providers across our area are overwhelmed and we don't have enough. Yeah. We need so many more, and that's a whole other topic. But when we do identify students that need help, the school counselor is there, accessible, on campus, and we need to utilize them as such.
And so the way you're describing it, they don't just sit in their office and wait for somebody to show up and say, I need help. They're proactive.
Yes.
And so, Dr. Salgado, you were saying get to know your school's counselor as a parent so that you know if this counselor is going to the room and just looking at stuff. So it's not like you have to send your child to the counselor's office. There's it's school.
Right.
Stigma is everywhere. Oh, we know where you're, that kind of thing. Right. So I have to believe that there's some sort of an
yes, the school
integrated program or something.
Right. The school counselor has access to the school, and they walk in and out of classrooms all the time, and students don't necessarily know what they're
looking for, what they're looking for,
what they're doing, or who they're looking for, or what. But they're used to it. They're used to the school counselor walking down the halls, going to lunch, going to the yard, going to a classroom, and that part of what the school counselor does is observe. Mm-hmm. But they don't necessarily know that they're observing any particular student.
Mm-hmm. So what would your best advice to a parent if they are noticing something at home, call the counselor, what would you say to advising a parent?
I would ask the parent, I would suggest to talk to the teacher first and foremost to get their insight about what's happening, and then to bring the school counselor in on that conversation and to make a really strong circle of support around that child. And just to be willing to listen. Sometimes our children won't be ready to talk about something. They may not have the language or the words to give us an idea of what's going on, but let them know that you are there and that you are ready to listen, that you're always open to that. And the hope is eventually, when they're ready, when they're able, they will disclose whatever they may be going through. And I can't just stress enough the importance of that school counselor and bringing them in so that you do get that extra support, whether it's an academic, career, social, emotional. They are trained and they will be there to help bridge any of those gaps and hopefully to provide a feeling of safety for a child. It's a very powerful feeling to know that there's one adult you can go to in a school who's not grading you, they're not They don't provide discipline. They're there to listen. There's confidentiality, just like in clinical mental health counseling, of course, with certain limitations. For students to know that they can go there. Counselors do a great job of destigmatizing students coming in. As a school counselor, I always told students, I meet with every student in the whole building. And so, you never know what someone's coming in for. It could be, just to talk about a class or to talk about scheduling, or it could be about something much deeper. So again, just want to put that plug in there for school counselors. They do a great job. And I think we still, quite a few people still don't know what a tremendous resource they are. Mm-hmm. So just utilize them, and they will really help your child in their path of success.
Well, that's got to be so encouraging for a parent. If they can have just what Dr. Salgado just said, at the beginning of the school year, go, okay, I need to find that person, because that is encouraging, even if their child isn't showing anything.
Right.
Just to know, like she said, just to know that there's somebody there.
And because that school stress that they're experiencing, whatever it is that is contributing to that school stress, be it academic in nature, social, emotional in nature, there is someone, a trained professional on site that is all hands on deck that can help out with the presenting issue. Your partner
in school.
Exactly, and invested.
Yeah, okay. Dr. Salgado, thank you so much for talking with us and providing your expertise. We really appreciate it when you're on the show.
Thank you so much. I appreciate it, and thank you all for highlighting this topic.
Sure.
So important.
We'll have you back. Thanks so much.
Thank you.
We're going to take a quick break. We'll be back in a minute.
Is it okay to call you Mom?
Of course you can.
Back talking about how stressful it can be to start a new school year or the beginning of the school year. Obviously, we're past the new part of it, but there are a lot of things that are happening. And as we kind of wrap up this, we kind of touched on it a little bit, but it's not just for elementary or middle school. It's even college. There's a lot of stress in college.
There's a lot of stress in college. A lot of stress. And it's true that we're not at the beginning of the school year. We are in the middle of the fall semester. And so in the beginning of the school year, everybody has those first day jitters. They experience the first couple of days, but then that should assuage. But then as the weeks go up or go on, we go into the 8th and 9th week. We're in the middle of the term, or the middle of the semester, and then there's this sense of, oh, where am I academically or socially? Right. Where do I fit in? And how am I being successful? Am I not being successful? That is a critical point. This is a critical point in the fall semester to assess and take action, because to do so later, as I've said several times before, it has significant impacts. And to one of the things that we need to talk about too is if there's a bullying situation or something that a student is experiencing, being tormented day in and day out, and they're having to face their tormentor throughout, the outcomes at the end of the year can be significant. We have seen in the United States in particular, these school shootings, mass shootings take place. They tend to happen more frequently in the spring, in the month of April, because it's a buildup over perhaps many years, and in particular over a course of a given year, that leads to something tragic. And so it's important to identify and address these things early on, be it something academic in nature or something social in nature. And so we need to have all of our eyes paying attention and addressing it early on.
Mm-hmm. It obviously anything, you catch it earlier, it's better.
Whether it's diabetes or hypertension or whatever, you catch it earlier, you have less of a complicated extreme situation with which to contend. And
you're thinking about even now, you have all that stress of going back to school, friends, blah, 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 who's the new teacher. But then, like you said, now toward the holidays, you're getting more of the tests, and the papers are due, and all those really truly academic things are coming up, which are going to show how you're doing in school.
Right.
Nobody got asked at the homecoming, or whatever.
Absolutely. And that's very important, because as those papers are due and those tests are coming up, and whether you are successfully meeting the standard or not, it helps to identify whether it's something in terms of the student just not being motivated and not managing their time and not doing what they need to do, or if there's perhaps some sort of learning situation that needs to be addressed. Perhaps it needs to be assessed and evaluated, and that takes time because there's a waiting list, and to have an individual education plan perhaps or an accommodation of some sort put in place, we need to identify that sooner than later, because if you identify it in April, then it won't be until the next year before you're able to address that, and then that sets the kid behind yet another year, as opposed to just that year.
Okay, any tips before we go?
Well, it's important to seek support early, be it the student or the parents, to seek support early. Communicate your needs from the get-go. This is a good time to do that, to find the resources, to see what accommodations can be made if needed. Stay informed about the resources. The school counselor is an excellent first resource to that end. Celebrate the achievements and have some fun. Not everything has to be so stressful. Their school is a time of fun and joy as well. Some of all our best, most favorite memories, if we're fortunate, are those related to school.
Or just watch when Peggy Sue got married, or whatever that was.
That's a great movie. I love that movie.
I know for a fact you don't use geometry. No, I shouldn't say that, right? Okay, anyway. All right, thank you, Dr. Roy Salgado, for talking things through. And of course, our guest today, Dr. Amanda Salgado, and all of your colleagues at the University of Holy Cross for helping out today. And thank you for watching and being a part of Coping Today.